This is the Emergency Medical Minute, sponsored by Health One.
This is Ricky Dhaliwal coming to you from Swedish Medical Center here in Denver, Colorado for your Medical Minute. So today we're going to talk about awake fiber optic intubations and specifically about the topicalization, because that is the key to success. So one of the most amazing airway experts that I know, who I was lucky enough to have as faculty where I trained at Hennepin County Medical Center, is Robert Reardon. Now, Dr. Reardon, he was a huge proponent of ensuring topicalization in awake intubations. The reason being is that you have way higher percentage of success or likelihood of success with a well anesthetized patient. On top of that, you decrease the risk of loss of airway function because you do not need to give things like ketamine or other sedative medications if the patient is properly topicalized. So the way that we did it, and which I've continued to do during my career, is with the use of two specific things. One is a URO-JET, so that's 2% lidocaine jelly, and two is LMX cream, which is a 4% lidocaine that you can purchase. Now, what you do is you take the URO-JET, you squirt it into the nostril, the nare that is larger. After applying the 2% lidocaine jelly, you can then semi-dilate the person's nares by using a pinky inserted into their nose to help increase the size, so hopefully a little less trauma from the ET tube. Now, the ET tube you're using is either a 6.5 or a 7.0 just because of size. Now, after you have their nose anesthetized, you squirted this URO-JET into their nare, then the most important piece and next piece is this LMX cream. And the way that you do this is that LMX comes as a paste that you can put onto a tongue depressor. Now, you squirt some of this onto a tongue depressor and you pretty much paint the patient's posterior oropharynx. You're painting the back of their tongue with this and letting it sit. What it does then is it slowly dissolves, and as it dissolves, it anesthetizes not only the tongue, but the epiglottis and that posterior oropharynx to give you a good topicalization. The way that you know that you have good topicalization is loss of gag reflex. Hopefully, this method of topicalization will be useful to you in your next awake intubation. And remember, two things: URO-JET, lidocaine 2% jelly into the nare, and 4% LMX cream to the posterior oropharynx and tongue, and allowing that to melt and anesthetize the posterior oropharynx. With that, I leave you, and good luck.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.